Thanks so much for joining us today. And I'm Gene Bookman. I'm the director of the Center for Integration Science at Brigham and Women's Hospital and the program in Global Non-Communicable Disease and Social Change at the Department of Global Health and Social Medicine at Harvard Medical School. And we're really lucky today to be able to host Dr. Saeed Arwal to speak to us about Afghanistan Non-Communicable Disease and Injuries Commission and his own personal journey. I've known Dr. Arwal now for something like almost a decade. We first became introduced when I was working on the Lancet NCDI Poverty Commission, Non-Communicable Diseases and Injuries Poverty Commission, and we had one of our commissioners, Soraya Dalil, who was a former Minister of Health of Afghanistan and was actually at that time an ambassador to the United Nations in Geneva. And we were really focused in that commission on the intersection of non-infectious diseases and extreme poverty. And clearly, Afghanistan was one of those places that had very high concentration of extreme poverty, and really was one of the few low-income countries at the time outside of Africa. And we're really excited to involve Afghanistan in the work, especially as we started to support national non-communicable diseases NCDI poverty commissions in about 16 countries. And so through that process, Ambassador Dalil introduced us to Dr. Arwal, and Dr. Arwal really led the commission in Afghanistan. And we worked together over a number of years, had a chance to meet, I believe, in maybe even in Kigali, and then subsequently in Oman, other places during that period. And as you'll hear, Dr. Arwal actually made a huge impact on policy in Afghanistan, and I think as you'll also hear, this was a real gap in the non-communicable diseases were a real gap in the understanding of what was affecting the population in Afghanistan and the nature of that disease burden as a result of his work. This was a real update in policy in 2018 in the integrated plan for the package of essential health services for Afghanistan. It was much more inclusive, and that was really teed up to have a big impact on health in Afghanistan before the COVID epidemic, and then the occupation of Afghanistan by the Taliban more recently. And we had been very worried about Dr. Arwal and his family during that period, and we've been very lucky that this past year, Dr. Arwal and his family, his son, his daughter, the rest of his family. He has two new grandchildren that are Americans now that are born here, that they were able to come here, and Dr. Arwal was actually able to join us as a scholar, as a fellow, through the work of great work also of the Scholars at Risk program at Harvard. Jane Unruh, I would say that Rebecca played a huge role here in the department, as did Jen, in terms of getting Dr. Arwal and his family situated here. And this is really the first time that he's going to speak publicly and inform us about this situation that I think has been weighing on all of us. And I just want to thank again Amy, or for the first time, I guess, Amy Craig, for the great work that she did organizing this, and this lovely meal for those of us that are here physically that we've been able to have with Dr. Arwal, Afghani meal, and to listen to some beautiful Dari music here. And also want to thank Jen Pachetti for hosting us as always, and Katie Player for doing so much to organize this meeting. And so with that, I'll hand over to Dr. Arwal. So thank you so much.
Bismillahirrahmanirrahim. First of all, thanks from Dr. Jane Bookman and all his team members. Yeah, okay. And yeah, it was well. Thank you. Okay. So, as I said, first of all, I would like to thank Jane Bookman and other team members, all who are mostly try in the last 1.5 years. I can say 1 month in 1 year and 2 months trying, and they did a lot to have evacuate me and my family from conflicted country Afghanistan to outside of Afghanistan, and also to finally bring us here to United States, Boston, and finally to the Harvard prestigious university here. And let me to thank, as Dr. Jean says, Jean Orbo, in the director for the Scholar at Risk program of Harvard University. In the same time, one other group of Sarah and her group, they make a lot of work and done. One of the lawyer, and he and they, all the team, try more. And even I can say day and night they try, and they was in touch with me and understand where am I and how is my family and when can I come out. So this was finally was the result of their efforts in trying. So now I'm not presenting you as you are familiar with some presentation of here of mostly the research in other study here. Today I will present as a evidence from Afghanistan, from the conflicted countries, since even I can say 45 years, the conflict situation was started in Afghanistan. And I can say at that time I was child to it when it was started. And now, you know, I became near to be old. And still the war, the fighting in conflict situation in Afghanistan is going on. So let me to, as a evidence and as a live evidence of this situation, I share with you first my history and to what was going there and how I as a person came in born in one village, very nice village of Khugiani district in Nangarhar province of Afghanistan. And it was my dream. And today I'm in Harvard University here. To this journey, I will talk some about that and to share with you So this is the agenda for today talking me or presenting this. My history is more, I will more focus on this. NCDI situation in Afghanistan, also in the Afghan National NCDI Poverty Commission, how I was involved in, how their work here. Maybe some of you didn't know about the NCDI Poverty Commission and network strongly support and work in other countries like Afghanistan. So I will share some data and facts. MOPH NCDI department. MOPH means Ministry of Public Health in Afghanistan. Just for the information, if someone wants. And some achievement during my engagement in NCDI Poverty Commission and challenges and next steps, I will talk about that. Here you can see this is my village in the remote area of Afghanistan, what I said, Khugiani district. And from this area up to Harvard University is a long journey. And in this journey, how it was not easy just to fly from here in Iraq, but it was a lot of challenges for me and a lot of the troubles. So I would like to share that with you. As I said, so I would like to share with you the evidence, like as a evidence what I saw and what was in my land. In 1960, I was born in Khugiani district of Nangarhar province of Afghanistan. At that time, I completed my primary school and secondary school in my nearest area of the village. And during 1978, I don't know, some of you, maybe he was also child at that time, but some of you maybe read that about that Russia attack on Afghanistan, and there was fighting for 13 years between Russia and Afghanistan. So at that time, the Mujahideen are big. Why I use this Mujahideen? This was the famous name what you may know, or in the news you can see that these people was sorry, against of the Russia fighting in this. So all the people, local people, joined with the Mujahideen at this time, with this group, because the Russia entered to Afghanistan with the fighting, with the airplanes, with the soldiers, with everything. So this was a really tough time for Afghanistan. More than 100,000 of people were martyred, and more than 200 thousands of the widow and orphan was there in Afghanistan. A lot of people were disabled. So this was a high level fighting between Afghans and the Russian peoples. So it was really a difficult time for not only for me, for everyone who are living in Afghanistan. So after 13 years war and helping by the United Nations in other peaceful government of the other countries, they helped with Afghans, and Russia was withdrawal from Afghanistan. Their soldier was withdrawal from Afghanistan. At this time, the Mujahideen take over of the government. But unfortunately, between the Mujahideen at this time, fighting, civil war was start in Afghanistan again. Between Mujahideen different groups, there was more than 10 groups of Mujahideen. Some was supported by our neighbor country, Pakistan, and some was supported by Iran and other neighbor countries. And there was fighting among them in Afghanistan. In this, again, it was happened, a lot of challenges for the people. And this picture, just I show that this is my village, very poor village at that time, when after that I went there some. In this picture, you can see when I came. So one thing I forget to say is that at this time of the Russian or communist regime in Afghanistan, twice they take me to the jail. Once I have been in I was in 12th class of the schools. The students of the school in the university, they make demonstration against the Russia invention in Afghanistan. So that they capture some of the people, one of them was and they take us to the jail. And they put us for a few days, and then they realizes, and after some time, when I was at the first class of the medical school, they take me again to the jails. And in the jail, there is a famous jail in Afghanistan. It's called Pulcherhi jail. In this jail for 3 years, I, with some of my colleagues, most of the students from university, you were there. And I can tell you, at this time, every night we hear a lot of, can say hundreds of people, students and doctors, teachers, and they was collecting and killed by these people. So we thought they will kill us, but this was the help of God. For some time we were alive, and was realized after 3 years. So after that, when they a little chance against for me, I start my medical school again. And after in 1988, I graduated from, in 1995, I graduated from medical school of Kabul Medical School. And I became a doctor. And I can say after that, I will share that I became I became a health hero for Afghanistan and try to work for how improve the health situation in my poor country and poor societies. So this was the and in 1995, as I said, the Taliban came the first time. Taliban came to Afghanistan, and they start from Kandahar province, and they came to Kabul, and they captured Kabul, capital of Afghanistan, and the government was in the hand of Taliban. So at this time, before they came to Dir, I was employed by an NGO, international NGO that's named HNI, HealthNet International. This was supported by European Union. And that was their headquarters was in Holland. And these people, for some time, they sent me to Karachi to Aga Khan University to take some training there for the management of the health activity, health projects in primary health care program in Afghanistan at that time. So, yeah, this was a big learning place for me first to be in the Aga Khan University in Pakistan. So when I returned, I started in this I employed as a health cluster management team leader at that time. There was the first health cluster established in Afghanistan by this HNI in 8 districts of Afghanistan. And the center of this health cluster was in Shinwar area, and that was in eastern region of Afghanistan. And I, as a head, or I can say the management team leader for this health cluster. So then, after that, we try how to implement the PHC primary health care. And how can we have the good model of the PHC here in that cluster? So even we was faced with a lot of problem with the Taliban at that time, because the government was with Taliban. But at least they allow us to work there in our area for the primary health care programs. So we start training of the community health worker, we start training of the TBAs, we start to create a community, shura community leader committees for solving of the problems, especially the health problems. So this was going on, and after 1 year or more than that, the people who suffer from the racist Taliban because of the radical work for Islam and wanted people to do this and that. And one thing let me to share with you, the Islam, more than 99% of the people in Afghanistan are Muslims. But Islam is not, unfortunately, different people are working for that as according to their politics, what they want to to do and how. For example, the people themselves, they are really Muslim, but they peaceful people. The people of Afghanistan, they like peace. They don't want to. They didn't go for war to the another countries, but unfortunately, Russia, Pakistan, Iran, and other peoples, they came there and they create problems. So the people have to defend, and they work for their land. So this was the big problem at that time. At that time, I can tell you at the end of this first period of Taliban, this was 9/11/2001, when the evidence was happening in New York, in America, in this 9/11. So at that time, I was in one training in Islamabad, and this training was that the facilitator was from the United States, one professor and his wife. And this was this 9/11, and then conflict situation in Afghanistan, more burn, and then. So what I thought, what will happen in Afghanistan? Once I remember that I went to, I sat with my professors and I told them, I will go tomorrow to Afghanistan. I will return if you allow me. They were surprised and they told me, Arwal, sit here. And he told me, why you want to, at this dangerous situation, you want to return to Afghanistan? The people are trying to come out. I said, I'm responsible for a big health project. And hundreds of doctors and nurses, midwives, they're working with me. If I'm not there as a leader, this will be difficult for them how to decide and what to do. And second thing is my family is still in Afghanistan, in Nangarhar. So I cannot leave them because I'm just here. So finally, they was agree with me, and I returned to Afghanistan, and I went to my area. I remember that this was around 6 p.m. when I reached my health cluster center. And when I reached there, all the staff, I knew how surprised all of them, and they came to me, and from this was one hospital we call Ghanikhil District Hospital. They came and they sit with me and they told, oh, it means everyone was so happy that I'm there with them. So the first thing what I did, I asked one of my staff members, please go up to this above the roof and draw a reed grass there. And this will be a sign of the hospital because I told them the fight will start here. And at least everyone should know this is the hospital, this is not the government other place. So we did a lot of, and then we went, and then I collect all the community leader at that night, around 15 people, strong people, community leaders. Sorry. And I told them, I'm here and I came here for this. You need us at this time more than other times. Now if you want, there are female and male staff with me. And they are here around the hospital, we build small houses for them. They are staying here. I want to keep them here for help with you people, because during fighting, there will be a lot of injured people in fashion in this. So, but if you are guaranteed that here will be no problem for the staff in this working on, the people are so happy and they says, as you want, we will do that. You see this 15 leader of that tribe, they stay with us in the hospital for 2 months. They day and night stay with us, and because to no one from the area come and touch these people in these doctors or medical staff. So that was so happy. And I gone to the Jalalabad city and take my family to the hospital too. I take my family and bring them to the hospital. So this was the situation, and finally you hear the regime was changed. Regime of Taliban was changed in the US Army with some other international army. They came to Afghanistan. And really the people were so happy at the beginning for the coming of this international forces from several countries, because to this conflict situation and war will be finished. and this will be ended, because the people were so suffer since a long time to that. And unfortunately, it was good for some time, some years, but restart this war and this fighting in this conflict situation again, and the people was surprised with how it's happened. All the international forces are here and it's going on. So at this time of the changing, what it was changed, the new government take place. One delegation of the donors in the Ministry of Public Health and other public partners, they came to visit. They hear about it, they know about our cluster, health cluster model. They visited our cluster model, and I presented, I remember them, all the things there is going on, all the program and plans. You know that at the first month of this changing of regime, I start community midwife training in my cluster. This was the first training of community midwife because it was more needed. May you know about the community midwife, or some of you, because the community midwife are needed less training for 1 year, because there was no more family staff in the district, in the health center. We needed to train the community midwife, and we train them, we start them, and we so this delegation came from Kabul, from the capital of Kabul, and they have visited our cluster, and we presented all of them. They returned back to Kabul. And when they returned after some time, they invite me to Kabul, to Ministry of Public Health. And they told me, no, you have to work here as a national wise. So they employed me as a PHC and community-based healthcare director for the Ministry of Public Health at that time. I start to work with that. And in this picture, you can see this is very important, that according to the public health way, the 3 partners is very important for the sustainability of the program. The first partner is community. Community should be engaged in the program for the getting the ownership of the program to be sustainable. If they not get the ownership, this program or this project will be not sustainable. And the second partner will be the government, Ministry of Public Health, Ministry of Defense, Ministry of Police in this. And the third is NGO, especially for the country like Afghanistan, poor country, who is supporting financially and technically UN and other donor and other partners. So this was, I start and I going every year to Afghanistan to work with the community engagement and strengthen the community-based healthcare program. So after the sometime, so in this time, one day I remember, I think in 2007, yes, a delegation of USAID MSH, may you hear some in name of this NGO and American NGOs, and this is working most of the countries, and they came to Afghanistan and they want to evaluate the staff of the health staff. So they find me and they announce me. Someone told me, Arwal, you know that they announced you as a hero, public health hero for Afghanistan. So it means this time this delegation came just to share with you this. And then in 2009 and 2011, up to 2011, I was able to take admission in the master program of community change and conservation in future generation university or school in United States. And I finished this and I returned back to my home, in my home country. And then I tried to reorganize the program because I learned the international experience to how to reorganize the primary healthcare and community-based healthcare program. And we worked together with that. And this time, WHO was decided to start a program of the BDN for the community engagement. BDN is needed, basic development needs. So I, as a head of community-based healthcare program, was a focal point from Minister of Public Health with the WHO for the BDN. In the same time, we want to bring some change in the health post. And the health post, we train at this time maybe 25,000, but up to the end 30,000 of the community health workers. Community health workers was, half of them was male and half of them were female, means more than 15,000 was female and the other was male. We trained these people, and they, in each health post, two of them, one male and one female, have been working for the primary health care of the villagers and the people there. At this time, we brought some change, and there was one other idea for how we can improve more this health post. So we talked with our task force. This was a strong task force in Ministry of Public Health. My idea was supported by UNFPA. You know about the UNFPA, for Organization of UN Work for the Population. And they support my idea, and they said we will support. And we create in the one other elements of the community-based health care that called FHH, Family Health House. Family Health House. In this Family Health House with the health post, we add to have one community midwife and one nurse with them. Because there was, for example, the criteria for the health center, where there was 1,000 families, there was no criteria to establish one health facility for this. So we tried how to cover them, at least for the basic service. We create for them Family Health House. And it is now a good model of the covering of this remote area. And one other one, which I work with the Johns Hopkins universities, and that is the community scorecard. I don't know, have you heard about that or not? Community scorecard is another model of how can we engage the community strongly, and how can we say that community will be accountable and they will be supporting the programs. And in this model of community scorecard, or future of health system, that's what I have been working for as a model in two provinces of Afghanistan, Takhar and Bamiyan. And it was a successful program, and even it's copied from there to another countries. And so for that, I have a good relation till now with the Johns Hopkins University, not only for I study for the future generation master program also, but I have relation with them. Yes. So this is just means at this time you can see I was in the one picture in Japan's with the people from other poor countries, and we went there how to learn and how to. In this other picture there is the deputy minister and dean of the medical schools and deputy deans of the medical school of Afghanistan and other professors. We were so it means just I want to assure you that how I came from this village and became a national person in my country, and now I am with you, and thank you so much for hearing to me. And this was my short story. And because of the time, I don't want to talk more about that. But any question, any time for any person, I will be more than happy. You know that I was so busy with the media, with the radio and TV and newspapers, call me everywhere, what is going on here in for the health in this crisis, and this is this. Even here also, when I came here, Voice of America and BBC there, I can say weekly they call me and they discuss with me about some issue of medical issue in Afghanistan. But I told them I'm now here. They said, we knew you are here, but we want. So this is about the NCD. You know that the NCD are one of the major health and development challenges of the 21st century in the world. The global epidemic of NCD is widely acknowledged as a major development challenge in the 21st century. So I don't want to talk about this. You know more than me. You hear more about the NCDs, but you can read that. So this was a big issue in our country. So why in 2017, at the beginning of 2017, the Minister of Public Health decided I should change my position, and they imply me as a head of the Non-Communicable Disease and Injuries Control Program in Afghanistan, in Minister of Public Health. So I started, and I was so happy, and this was my, that I find your teams, Professor Jane Bokman and other NCDI Poverty Commission, and they support along us in this work. So, you know, NCD actually take the part after 2015 in the world. Before that, there was in worldwide no good attention for the non-communicable disease, but the more attention was in MDG for the communicable disease. But after that, so fortunately for the SDG, when MDG is changed to SDG, there was a good place for the covering or prevention of non-communicable disease in the SDGs. So every year starts. So we also in Minister of Public Health established one of the department at that time, and I became as head of this department in 2017. And in Afghanistan, the NCD is burden of NCDs because of the, you know, the old population are more likely to be affected by NCDs. And the health burden NCD will rise in parallel with the population aging, because in last 20 years, I can say before Taliban, this in Afghanistan, the government of the last government really means not 100% they work well. I will not support the last government 100%. They did a lot of work or good work. No, there was a lot of challenge. There was corruption, unfortunately. You know that how some people means try to change their way in be beside of the Taliban because of corruption of the last government. And there was a lot of issue, but they did something. But one thing I can say that the donation what we got from the world, if it was really properly used with honesty, so maybe we now was not in the present situation in Afghanistan as it is. So, so you know that 46% of the death is because of the NCDI. NCDI means you know, injuries, because especially the road injuries. And we didn't count fighting or war injuries in that. That is more than this. That we are only focused on the road injuries in the NCD. Okay. So in this slides, you can see, unfortunately, this is from 2009 to 2019. If you see how the situation was, or indicator was changing in Afghanistan. But still you see, because as I said, the indicators in which was for the communicable disease, it get good. Now it is going down. But the indicator or service for the control of non-communicable disease, it is still going up. Still, this is the problem because there was no attention before 2017, and after 2017, you know, it's not possible to just we do not have had any donor for the NCDI programs. Other program was supported by 3 donors in Afghanistan: USAID and EU, European Union, and World Bank. There was, but for the NCD, no one supported NCD because this was not a problem for them, for other countries. So this was not supported by them. The only some partner like Harvard Medical School, NCDI Poverty Commission, and some of the other partners of WHO in some cases. Still, this was a big issue, and these slides will be with you, and you can see that. And for the risk factors also, this is a big issue for the non-communicable disease in Afghanistan. This is also, you can see high blood pressure, you can see the using of sugar, using of salt, and this was a big issue. And so therefore, still this is a big issue. And because after 2019, there is actually the practical work is not done well, not new programs. In generally, you can see in 1990 how much the coverage of the health service, and then in 2010, and you can see in 2019. But it is, you see 39.3%. It is not the best coverage for all population. Still, we have had with the last government a lot of the issue and problems. This here is just for your information, the NCDI program. What we were designed that there was just a few department was active, and we were able to make it active in Ministry of Public Health. And we focus on the 4 disease more. That's, you know, the strategy of the WHO for control of that 4x4 or 5x5. That is the cancer, COPD, diabetes, and cancer, diabetes, and COPD. And what the other important part of that? Yes, heart disease. So these are the big, and just we were able to convince the Ministry of Public Health to employ some people for these programs. So means the NCDI program was newly started, and it was near to be stained by the feet, but unfortunately. At this time, we work on the plan for the improvement, plan for the non-communicable disease and injuries, and we work together with the partners, and we work with the WHO. And the same time, we draft a plan and we send it to Professor Jane and the team in NCDI Poverty Commission, and we get their feedback on that. And we were able to how to be, according to the SDG, to implement that, to have the plan and then how to implement that. The targets, you know, that WHO created at that time, they put some targets for the control of the NCD program. Usually it is famous by 25 by 25. Means 25% of that should be covered up to 2025. And we try how can we do that in these targets, what's mentioned already there, you know all about that, in how many percent we should, in our plan, we can implement that. And National Strategic Prevention and Control, this is another plan. You can see some subject in some objects in for that activities, what we were designed in here also. You can see the technical cooperation program in the Ministry of Public Health, which was supported by some partners. but what we name, how we name this, the new plan, unfortunately, just we final in, I came out with that program and Taliban is came. And this was the inter-ministry life course action plan. Means the NCD cannot be controlled only by the public health ministry or by health partners. This should be work with the other partners. As you know, one of the strategy of the primary health care to strengthen coordination among the partners. To all the partners should involved in, be involved and take part in for controlling. Otherwise, it's not possible. So for that, we put action-oriented, result-driven, clear rules in responsibility, clear timeline in when scenario, align with national and international parties or partners, coordinated with undergoing or planned activities by other actors. So in this plan, of course, we have this plan from 2021 to 2025. This plan was. And this plan, these were the important area of this plan. And strategic objective of the NCDI strategic plan was this. You can read it and you can see it to strengthen national governments. First thing was, as I said, because of we are more suffer from the corruption. In the poor country, unfortunately, a lot of them are suffering from the corruption. So therefore, the strengthening of national governance for NCDI prevention, this was very important how to do it. And to reduce risk factor, and these was so the items. So let me to talk about a few minutes for the NCDI poverty. Yes, 5 minutes. Okay. NCDI Poverty Commission or NCDI Poverty Commission or network support a lot for the NCDI program, control program in Afghanistan. I can say we can invited and attended different national, international or world conference meeting in Oman, in Dubai, and in some other countries. And in the same time, for the capacity building of the team of Afghanistan NCDI. In the same time, we got two projects from the NCDI and health partners. That the first very important project, because at least the people know how is the NCD in Afghanistan and what's going on here. That was the literature review, the first project, literature review for to understand the condition of NCD in Afghanistan. I remember, I think 250 around literature we reviewed at that time, national and international literature. And finally, we, together with the NCDI Poverty Commission from here, we prepare a plan report and we present it to all the key people and policy people in this. And the second project was, if I share with you the finding of this project, it will take more time. The second project was the clinical guidelines for service inside during the COVID-19 pandemic. So the pandemic of, the pandemic of COVID-19 in every year, but in Afghanistan at that time, how we have had a project to the young people who have the non-communicable disease in the same time, how they are going with the COVID-19 in Afghanistan. So for that, we select a district and we implement a project and we share this report. In generally, in this 3 years, I can say this from 2017, 18, 19, and 24 years. Just we got some times that we become a member of the NCDI Poverty Commission and complete study and completed the STEP survey. STEP survey is very important survey for the NCDI from WHO every 5 years or sometime 3 years. It's done by WHO. It's supported by WHO for understanding of the risk factor condition in countries. So we complete that, and so the different task force in national multi-sectoral coordination committee we established in Afghanistan, in strategic planning, these things, what we say. So it was very important how to get convince the people to have important the NCD at this time. So we try, and we was happy. Even the leadership of the government and the UN agencies, they was agree with us to start more work for the prevention of non-communicable disease. So I talk here about this this project, what was supported by NCDI Poverty Commission and health partners in Afghanistan. And you can see our teams and people going into the area and work with the people, collect the information, and we are presenting that too. You know, all of you know more than me about this network, what is really very important, and I can say is congratulations for all these teams, and really it is very successful program for the controlling of more or billion of poverty situation or poor people with the NCDs in the world. You know, all the diseases dangers for the people, in all people, especially for the poor people, because they do not have any facilities, and they are more in difficult conditions. So this is the only network to take action in this in the Lancet, and also you see that the 16 NCDI Poverty Commission we have, and now we have 328 members or commissioners in these groups in each country, 15, 16, or in the 16 countries, and even some more. And in this map also you can see in the groups there are different, each country NCDI Poverty Commission teams are. And here is also, this is the same what I wanted to explain in. So of course, as I explained from 2003, the new government of supported by the world till 2021, a lot of change was and a lot of improvement was, but not as much as should be. And I'm talking about the community-based healthcare. Hopefully sometime you will understand, you will get information about that, how it was supported. And I don't want to talk more, because if someone has some more question about that, and in these pictures I want to show you, these are the picture of the NCDI Poverty Commissions, what we are attended at the same time in Dubai, and also in Oman, in some meeting with the leadership. And this is, I was presented this project which was implemented, and this was given by NCDI to the all key person in Ministry of Public Health in Afghanistan. And here also you can see this, and in one of the picture, I'm in Tromsø, University of Norway. I presented to the master students there. I gave lecture to them, primary health care and how to integrate NCD in primary health care. And this was just something like that. Challenges are a lot. Insecurity is a big challenge in Afghanistan. Poverty is another big challenges. And the last one I can say is the corruption is a big challenge in everywhere, especially in Afghanistan. And for the next step, this is very important, hopefully, to the NCDI Poverty Commission leadership will read this and hope to be support in the future for Afghanistan, these findings. The Commission finding is support the need for expansion of the NCDI agenda in Afghanistan in the future. Afghanistan has affirmed its stance on NCDI and national policies and plan. However, the burden remains immense. This proportionality affecting your young and productive population, this burden may not be prevented or addressed by the current strategic framework in Afghanistan. So these are the few things I would like to share with the leadership of the NCDI party and in the future. These are some pictures. I'm in John Hopkins with the leaders. And one person I would like to say is Professor Carl Taylor, who is the founder of Primary Health Care and Al-Mata Declaration. May you hear about Al-Mata Declaration. He is beside me, and this professor, he died, but he was a very, very honest and strong man. And these, my team members in Afghanistan, who was before in the in last regime. And this is the First Lady of Afghanistan. I present the NCDI issues to her, and this was at the end of the program. And that's the Geneva conference I'm there. And this is with the Minister of Public Health during the International Health Days about the NCDI. And this is and beside the previous President Ashraf Ghani. And I talk and present to him a lot of this issue, but unfortunately, everything was changed. And this is like one Nuristan, what we talk with this picture of him. So thank you so much. And if any, yeah, please.
I have a question. You said that half of your workforce was built up by women. Do you know what has happened since the Taliban has decided that women can no longer work in Afghanistan? What is going on with the workforce?
One of the issues why the Taliban was trying to find me and send me again to the jail, that was that I have been more work for the community engagement. And that was training of 15,000 female community health workers. They're still in the country, they're still in the village, but unfortunately no one is supporting them, and they're there, and hopefully to find time and some time to support them. And that not only that, 4,500 of community midwife was trained by the initiative what I was a key person for that. And this 4,500 community midwife was covered all the health facility where there is no female staff in the remote area of Afghanistan. Yes, hopefully it's answer or not.
Yes. Well, actually, no, you gave me your question. Does that mean that the community midwives are not delivering the babies and men are now?
You mean how Taliban was against?
So if the women cannot work and they're still out there, does that mean that babies have to be delivered by men?
Of course, but unfortunately, in this regime of Taliban, the men also have problem for how to attend the women for delivery and for this. This is the issue culturally also. This is an issue in my country, and how we try to have initiative of a community midwife training for them and community health worker for them. So this was, yeah. If there is any other question, please.
Dr. Arwal, I'm going to take the liberty of maybe asking just one last question. I'm kind of up on time. I think probably one thing that everyone's wondering is what do you think of the current situation, and what hope do you have for Afghanistan now?
Yes, for the present situation, not only me. You know that on that day in hours, when Taliban arrived to the capital of Kabul, I was in my office. I working at that time. And we did not believe that Taliban will come in, culture in everything will be changed 100%. Even someone told me, Arwal, everyone is gone and you are here, there is danger. I said no. So it means this was in the future, we hope, because what we are in touch now, I'm in touch with the people who are in Afghanistan and how suffering they from the life and from the health service. So, but the situation will change. Situation will change because the people don't like it, don't want it to be in this condition. And but hopefully to change positively and to not be again in the conflict going on and changing. So we hope how can this issue. Yes. Thank you so much. Once again, I would like to thank the team, Katie and Ami, especially for providing a good service in food and even the Afghani music in these meetings. And hopefully I'm here to learn from you people, from you all. So hopefully I will be in touch with each of you and to learn from you and to implement that in the next time. Thank you so much.
Thank you for sharing that. That was really great.
Yeah.
Thank you.
Thank you so much.
Thank you.
For your support. Thank you so much.
Thank you.